Hello, and welcome to our first video production of We Talk Health podcast. Welcome, ladies. I am here on site at the GYN Specialist Clinic with Hazel Boyd. She is the clinic manager of GYN Specialists, and Tina Rutherford. She is the mammographer. So the reason we're here today is because, number one, October is Breast Cancer Awareness Month, and we've got something special coming up for the very first time. Is that right?
Yes, ma'am. October 28th, here at the clinic, we're going to do a girls' night in. We are going to allow everyone to come in and check out the mammography suite that we have just opened. We started July 10th. We're going to have food, shopping, and other vendors for everyone to check out.
So this is the first time we're going to be doing this, so that's really exciting.
Yes.
And I know that is something that's not something people really enjoy, is getting a mammogram. That's really a lot of ladies' least favorite thing to do or think about. So what can you tell us about how it is done here and, kind of what can help ease that discomfort?
Well, since I am the only room in the building that does mammography, the patients feel like it's a little more private and a little more intimate as opposed to sitting in a large waiting room. And we just do screening mammograms here, so their anxiety is a little less. And I'm able to spend a little more one-on-one with them, get them to relax and not make it seem so terrible.
Right. So it's on site, so you're not having to come here, have your regular, because that exam is also a really fun one too, that a lot of people look forward to.
We can do your annual exam and your mammogram same day.
Same day. Mm-hmm. So that takes away, a whole separate scheduling, a whole separate time you got to take off
across
work.
Town.
Going to a completely different building and checking in and doing all that. So you're able to do it all right here. Tell us a little bit about the doctors here.
So we have Dr. Wilson, Dr. Ball, Dr. Pearson, we have Amy White. Together they have practiced in Jackson an unknown amount of time. They have been everybody knows them. They are some of the best providers in the area, and they are loved by their patients and by their staff. We do love them so much. And they came to West Tennessee Healthcare with a goal of setting up a clinic that's welcoming, that's comfortable, that's relaxing. And as somebody who came in after that all started, I feel like they have excelled at that. It's a very relaxing environment. There's not a lot of stuff going on. You're not rushed through your appointments here. You come in, you see the provider, they'll talk to you, answer all your questions, and if you need an ultrasound, we have ultrasound on. Okay, yeah. We have ultrasound in clinic as well. And now we have mammography. We can kind of do just about anything that is needed as far as a gynecology need. And
when did the mammography?
July 10th was our first day.
And it's a 3D mammo, so
yes.
It kind of is. Mm-hmm. Do you want to tell us a little bit about that, Tina? Like, what's the difference between a 3D mammo and I guess what was being used before?
This machine does do 3D. It does have the capability of doing 2D as well, or two-dimensional. But the gold standard is for patients to get 3D. So what that does, it'll take, while you're in compression, we still do the same routine 2 views on each breast. The machine will take a series of about 15 different little projections, and then the computer regenerates those to create a 2D looking image. So we're giving them less dose than what they would have had if it would have been a 3D with a 2D combo. But the radiologist is able to scroll through that breast 1 millimeter at a time. Oh, wow. So it's like looking at slices of bread versus a loaf of bread.
Okay,
so very detailed. The machine is state of the art.
Great, yeah.
The patients love it. The paddles have a nice little flex to them, so it's a little more comfortable.
Yeah, because you want people to be as comfortable as possible for, what is having to be done, for preventative screening as well. Because that's definitely, with this open house, we want to, have the ladies tour the space, be able to see the mammography room. So, you have an idea of where you're heading to. And there's also a really beautiful, I know you guys have a whole separate waiting area that's very beautiful.
Yes.
And in terms of the building itself, it's a very updated, nice building. We've got all of this artwork here. So this is just one piece, but throughout the clinic, tell us a little bit about the artwork.
Throughout the clinic, Dr. Wilson's wife has painted every piece of artwork in the clinic and placed it Her and Dr. Wilson have placed it themselves.
Wow.
And everything you see is straight from Miss Liz.
And I get to, as I came in here, I got to tour the building. I mean, they're everywhere.
They're everywhere.
This must be her full-time job, like, as she is an artist. And they're all so beautiful, and it really does flow and come together.
She's kept it's kind of got the color theme throughout the clinic. So you see the same, not the same picture, but it just kind of it flows through the clinic with her artwork.
So for the night of, I mean, you'll be able to come to the clinic, get to tour the space, get to see all the different rooms. Will there be providers there?
There will be providers here. Tina will be here, and most of our nursing staff will be here for questions as well. It'll start at about 5:30 and go to 8, and we will be scheduling mammograms at that point, and we can get you in pretty quick.
Right.
Versus the longer wait time, because we have just started it. So we still have openings where we can get someone in within a week or less, depending on their schedule and what their needs are.
Right, yes. And so this event, it's after work, 5:30 to 8. So that way you can pick up any kids you need to.
Do anything you need to.
And will there be food?
Yes, we're going to have finger foods and some mocktails, and we want everyone to come in and be as relaxed as possible and just get to know us.
Right, yeah. So just taking the day. So they kind of wanted to call it a girls' night in. So it's like, leave your family, your husband's at home, come on down and hang out with some other ladies and get to enjoy the space and get to see everything that's going on here. So now I know we've got vendors as well that are going to be participating.
We have a few different vendors. We're still in process with some of them, but we're going to have a hat bar for anyone who, they put those
cute little patches.
Patches on the hat. We're going to have an esthetician. We're going to have a permanent jewelry vendor, and we're going to try to have a massage therapist in here
it's chair. It'll be chair massages.
Chair massages, Chair massages, just something 5 minutes, and you'll just, however they want to set that up, we'll do that. But we'll have some food, and you can just tour the whole building and check out the whole building and see. I mean, it's just a great facility.
Just relax and just hang out. Yeah. Is there going to be coffee there? I mean,
yes, we're doing a coffee and a tea bar. We're going to do a coffee and a tea bar.
That's what I need. Yeah. Even in the afternoon, just make sure you have decaf for some people.
We are having giveaways. We'll obviously have some swag, and then we're going to have a basket giveaway, and we're still working on other giveaways.
So there's going to be several items that you can. Will it be shown up at the front?
We'll have it at the front desk with a sign up of some kind for them to put that in, and then probably the next day we'll draw someone. We'll have one of the providers draw, and then we'll reach out for whoever wins to pick that up and come to the clinic.
So lots of cool stuff happening at this event, and I mean it's all to help raise awareness of breast cancer awareness, because with these screenings, I know that's such a. I don't know, Tina, if you want to share a story or anything about if you caught something early, like what it means to people.
Oh, it's very important. And I believe since we're here, then the providers, I'm doing a lot of baseline mammograms, the 40-year-olds that haven't had their mammogram yet, but they're at that age. And it's wonderful to catch them, because the sooner we catch that breast cancer,
the outcome is so much better. Yeah.
Yes.
So this is such a great opportunity to come hang out and check out the space. This clinic here, I know in the community, there are so many, you had mentioned that there are so many ladies that this is where they've been going for years. It's just such a, it's not like, I have to go to the doctor. It's like, I get to go see my doctor and see all the ladies that work here. So this is a great opportunity. So 5:30 to 8 on Monday, October 28th. It's going to be here at the GYN Specialists Clinic. The address is 395 Hospital Boulevard in Jackson. So it's right near the North Hospital location. So as many ladies that can come out and
hang out with us.
Yeah, come hang out with us.
Yes.
Thank you guys so much for being here.
Thank you so much.
Thank you.
Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.